The most dangerous moment in a rodent-infested room may not be when you see a mouse. It may be the moment you reach for a broom.
If you are over 60 and about to clean an old garage, attic, shed, cabin, basement, camper, or vehicle, stop for a minute. Dry sweeping or vacuuming rodent droppings can send contaminated dust into the air, where it may be breathed deep into the lungs. Most people will never develop hantavirus disease and it remains uncommon, but when it does occur, it can become severe very quickly. Today you will learn how hantavirus is spread, which symptoms deserve urgent attention, and how to clean a rodent-contaminated space without turning a preventable exposure into a medical emergency. This video is for education, not diagnosis. It is not meant to frighten you, and it does not mean every mouse carries hantavirus. Your actual risk depends on where you live, the rodent species involved, the amount of contamination, and the type of exposure. The cleaning rules here also reduce contact with other germs carried by rodents. Follow local public health instructions when they differ from this advice. Hantaviruses are a group of viruses carried mainly by rodents. Different types exist in different parts of the world. In the Americas, some hantaviruses can cause Hantavirus Pulmonary Syndrome, a rare but potentially life-threatening illness that affects the lungs and circulation. In parts of Europe and Asia, other hantaviruses more commonly affect the kidneys. Most hantaviruses do not spread from person to person. The usual source is an infected rodent and the material it leaves behind: urine, droppings, saliva, or nesting debris. One exception is Andes virus in parts of South America, which has occasionally spread between people during close contact. How does exposure occur? Picture a shed closed for months. Mice move through boxes, insulation, tools, and stored food. Their waste dries on the floor. You open the door, move objects, and sweep. Tiny particles rise into the air. If contaminated material is present, breathing that dust is one possible route of infection. Exposure can also happen when contaminated material gets on your hands and you touch your eyes, nose, or mouth. Rodent bites are another possible route, though less common. The risk is greater with close contact to rodent waste in enclosed or poorly ventilated spaces, not simply from seeing a mouse outdoors. For adults over 60, the goal is caution, not panic. Many older adults live with asthma, chronic lung or heart disease, diabetes, reduced mobility, or immune-affecting medications. A severe respiratory illness may be harder to tolerate. Even healthy people in their 60s or 70s should avoid unnecessary exposure. Now symptoms. Hantavirus illness can initially resemble many common infections. Symptoms may begin days or weeks after exposure. Early signs include fever, marked fatigue, headache, chills, and muscle aches. Some people have nausea, vomiting, diarrhea, or abdominal discomfort. Those symptoms alone do not prove hantavirus. Influenza, COVID-19, pneumonia, and many other illnesses can look similar. The detail that changes the picture is a recent history of meaningful rodent exposure. Later, some people develop coughing, chest tightness, or increasing shortness of breath. That is when delay becomes dangerous. New, worsening, or severe breathing difficulty after cleaning or spending time in a rodent-infested space requires urgent medical evaluation. Do not try to identify the virus yourself. Do not rely on a video, symptom checker, or home remedy. Contact emergency services or seek urgent medical care according to symptom severity, and tell the medical team, "I was recently exposed to rodent droppings or nesting material." That exposure history helps clinicians consider appropriate tests and treatment. There is no approved home treatment that stops hantavirus disease. Medical care is supportive and may include oxygen, careful fluid management, and intensive respiratory or circulatory support in severe cases. Earlier evaluation gives clinicians more time to respond if the illness progresses. Prevention is the best strategy. Here are 5 practical rules every older adult and anyone helping them should know. Rule number 5. Inspect before you disturb. Before entering a garage, shed, attic, barn, cabin, storage room, crawl space, camper, or vehicle that has been closed for a long time, look for signs of rodents. Dark pellet-like droppings, shredded paper or insulation, gnawed food packages, damaged wiring, nesting material, or a strong stale odor. Do not kneel close to the waste. Do not touch it with bare hands. Do not begin sweeping simply because you want the room cleaned quickly. If the space is heavily contaminated, contains many dead rodents, or is difficult to ventilate, this may not be a safe do-it-yourself job. Older adults with heart or lung disease, balance problems, or limited mobility should be especially cautious. A qualified pest control or cleanup professional may be the better choice. Rule number 4. Ventilate the space first. Open doors and windows from the outside when possible. Leave the area and allow fresh air to move through before cleaning. Avoid standing in the airflow coming directly out of the contaminated space. Ventilation helps dilute airborne dust, but it does not replace safe cleaning. You still need gloves, disinfectant, and a wet cleaning method. If the building has been sealed for months, do not switch on a fan that blows dust around. The objective is gentle fresh air exchange, not creating a storm of particles. Rule number 3. Never dry sweep or vacuum rodent waste. A broom, household vacuum, shop vacuum, or leaf blower can disturb dried urine and droppings and push particles into the air. The room may look cleaner while the exposure risk becomes worse. Instead, put on rubber or plastic gloves. Thoroughly wet the droppings, urine, dead rodent, and surrounding area with an appropriate disinfectant. Use an EPA-registered disinfectant according to its label, or follow current bleach solution instructions from your national or local public health authority. Never mix bleach with ammonia, acids, vinegar, or other cleaners because dangerous gases can form. Let the disinfectant remain wet for the recommended contact time. Then use paper towels or disposable cloths to pick up the material. Place the waste in a suitable bag or covered container and follow local disposal guidance. Disinfect the surrounding hard surfaces afterward. For upholstered furniture, carpets, insulation, stored papers, ventilation systems, or extensive contamination, the correct method may differ. Do not improvise. Consult public health guidance or a professional experienced in rodent cleanup. Rule number 2. Use protection that matches the job. Gloves are essential. They protect cuts and reduce the chance of transferring material to your face. After removing gloves, wash your hands thoroughly with soap and water. Keep hands away from eyes, nose, and mouth while cleaning. Cover any open cuts before starting. Wear clothes, shoes, and clothing that can be washed afterward. Respiratory protection depends on contamination level and the task. For a small amount of waste in a well-ventilated home, follow local health authority recommendations. For heavy infestation, confined spaces, demolition, or occupational cleanup, a properly fitted respirator and additional protective equipment may be required. A loose mask is not a substitute for professional respiratory protection, and facial hair can prevent a tight seal. Buying equipment does not make a dangerous job safe if you do not know how to use it. If the infestation is extensive, bring in trained help. Rule number 1. Control the rodents so the contamination does not return. Cleaning droppings without solving the infestation is temporary. Seal holes and gaps rodents use to enter. Repair damaged screens and doors. Store food, birdseed, and pet food in secure containers. Remove clutter that provides nesting material. Keep rubbish covered. Clean food preparation areas and do not leave pet food out overnight. Use rodent control methods appropriate for your home and local regulations. If you cannot safely inspect roofs, crawl spaces, ladders, or tight areas, ask a family member or professional to do it. Falls are a more common danger for older adults than hantavirus, so prevention should not create a second hazard. After infestation control, continue checking the area. New droppings mean rodents may still be active. Do not handle traps or dead rodents with bare hands, and follow official instructions for disinfection and disposal. Now 4 myths to correct. Myth 1. Every mouse carries hantavirus. False. Only certain rodent species carry particular hantaviruses and prevalence varies by location. You cannot identify an infected rodent by appearance, so the sensible approach is careful handling of rodent waste. Myth 2. I have cleaned droppings before and never became ill, so my method must be safe. False. Past luck is not a safety protocol. Exposure does not occur every time, but dry sweeping remains an avoidable risk. Myth 3. If I feel well the next day, I am in the clear. Not necessarily. Symptoms may take time to appear. Remember the exposure and watch for genuine illness during the following weeks. If fever or flu-like symptoms develop, contact a healthcare professional and mention the exposure. If breathing becomes difficult, seek urgent care. Myth 4. Hantavirus spreads easily from person to person. Usually false. Most human infections come from rodents, not routine contact with infected people. Limited person-to-person transmission has been documented mainly with Andes virus. Public health officials provide specific instructions when that strain is a concern. A simple scenario. You are 68 and open a family cabin for the first time since winter. You find droppings near the pantry and inside a lower cabinet. The unsafe response is to close the door, grab a broom, sweep everything quickly, and vacuum the corners. The safer response is to stop, keep other people and pets away, ventilate the cabin, put on gloves, wet the contamination with the correct disinfectant, wait the stated contact time, wipe it up without stirring dust, dispose of it safely, clean the surrounding surfaces. Then identify where rodents entered and fix the problem. That sequence is not dramatic. It is effective. What to do after a possible exposure with no symptoms? In most cases, simply touching a box in a shed does not require emergency testing. Routine testing of a healthy person after a vague exposure is not always useful. Wash up, document when and where the exposure occurred, and contact a healthcare professional or public health service if the exposure was substantial, involved heavy contamination, or occurred in an area with known hantavirus activity. Your doctor can advise based on your location, medical history, and the nature of the exposure. Do not stop prescribed medications or change treatment because of something you saw in a video. What to do if symptoms appear? Think in 3 levels. First, mild symptoms with no breathing difficulty. Contact a healthcare professional promptly, explain the symptoms, and mention the rodent exposure and date. Second, worsening cough, chest tightness, unusual weakness, dizziness, or shortness of breath. Seek urgent medical assessment. Do not drive yourself if you feel faint or cannot breathe normally. Third, severe trouble breathing, confusion, bluish lips or face, collapse, or inability to stay awake. Call emergency services immediately. These warning signs can occur with many dangerous conditions. The goal is to recognize when the body needs urgent help, not to diagnose the cause at home. Before you finish, take 10 seconds and answer these questions to yourself. Is there a garage, attic, shed, cabin, barn, camper, storage room, or unused vehicle you plan to clean? Has it been closed for weeks or months? Have you seen droppings, nests, gnaw marks, or damaged food packaging? Do you have gloves and the correct disinfectant? Do you know who will help if the contamination is too extensive? If you answered yes to the first 3 and no to the last 2, do not begin cleaning yet. Preparation is part of the job. The key message is simple. Hantavirus disease is uncommon but can be serious. The threat is not an invisible wave attacking every adult over 60. The real controllable risk is unsafe contact with infected rodent waste. Do not dry sweep. Do not vacuum contaminated material. Ventilate first. Wet the area with the correct disinfectant. Wear appropriate protection. Control the infestation. And if illness develops after a meaningful rodent exposure, especially if breathing becomes difficult, seek medical care and clearly report that exposure. You do not need fear to protect yourself. You need a correct procedure. Share this video with the person in your family who opens the cabin, clears the garage, works in the barn, or cleans the storage room. One safe cleanup can prevent an exposure that never needed to happen. Which space around your home needs a rodent-safe cleanup?